Hey guys, we're live on YouTube and Facebook. We're doing dueling live streams right now. So if you're watching me on YouTube, welcome. We're gonna do just an Ask Me Anything, just like we do most Fridays, so Facebook Friday. Let me mute this thing so you don't have to hear me talking over and over. Great, so as people are tuning in, I'll start to answer your questions. And I'm gonna tell you about a couple things real quick today. The first of which is a recent study. I'm going to do a bigger video on this on YouTube when I have time to actually sit down and really film it, but it looks at the potential harms of fast food intake with regard to fertility. So I found this interesting. It was a big survey I forget which European country right now, that did dietary surveys of people in the month before they got pregnant, and basically what they found was that the more fast food intake somebody had on a daily, weekly, monthly basis, they showed declining fertility rates, and it was statistically significant. And even as simple as 1 serving or 2 servings a week was enough to start to have an effect on fertility. So when you're trying to get pregnant and you're doing everything you can to try to get pregnant, you know, this is a simple thing that you could possibly do to improve your chances, and that is don't eat food from McDonald's. I mean, I guess it's kind of obvious that that stuff's not good for you, but I mean, I think it's the first study I've seen that really looked at the relationship between dietary intake, specifically fast food, and fertility outcomes. So that's just something to keep in mind, guys. If you're trying to get pregnant, that might be a good idea not to have fast food. So as everybody's jumping on, welcome. Hey, it's Wes Davis, Facebook Friday, and I'm here to take your questions. So if you have questions, you can put them in the comments. If anybody can see me or hear me, put in a comment, either on YouTube or Facebook, wherever you're watching, so I can know that you can hear me and you can see me. So just kind of waiting on some comments to come in to answer questions from. So as you're logging on, I'll tell you about one other study that I'm going to do a video on here shortly. That has to do with the potential for using acupuncture with infertility treatments. So there are lots of places online that if you go, and I've seen some on Instagram and other places as well, sort of advertising using acupuncture as an adjunctive therapy for infertility. So, you know, talking about using acupuncture treatments in the ovulation induction portion where they're getting their fertility drugs, and then also at the embryo transfer, and, you know, making some claims that they are improving fertility outcomes. It sounds good. It's Chinese medicine. It's old school. It sounds like something, hey, why not? But at least one big study of about 900 women trying to get pregnant with in vitro actually showed there was no improvement with fertility outcomes. So, you know, based on that, I wouldn't recommend that you spend your money on acupuncture as an adjunctive therapy to in vitro, because it looks like it doesn't do any good, and it costs anywhere from 50 to $100 a pop. So you know, if you're doing 2 or 3 cycles and you're getting 2 or 3 treatments, you're talking upwards of $1,000 for a therapy that apparently doesn't have any real benefit. So just something to keep in mind if you're out there and working on fertility treatments, that probably acupuncture is not something you need to spend your money on. So hey, I see lots of folks jumping on the stream. If you can hear me or see me, put a comment up. I want to make sure that comment parts are working, particularly on Facebook. Thanks, I'm seeing hey Keely, I'm seeing one on YouTube, so I know YouTube's working. Let me see if I can get that comment to come back up. All right, let's see. Hey Didi, let's see, what kind of exercise do you recommend trying to conceive? Is too much bad? So, you know, basically there's no evidence that that normal amounts of exercise are in any way harmful with regard to fertility, and in fact there's evidence to the contrary. So you know, generally speaking, I think that exercise is a good thing. About the only thing I'd tell somebody is, you know, if you're exercising so hard that you're not having your periods, then that's probably too hard. Obviously, you know, you hear of some people who are running on marathons and training really hard. I had a patient who was actually training for the Olympics and wasn't having her periods. So, you know, I think in those situations, those types of extreme exercise do prevent ovulation, and so I wouldn't recommend that. But beyond just that kind of extreme stuff, pretty much anything else is fine. So I definitely encourage people to stay active. All right, so I'm just gonna take a peek over here at Facebook on the comments. All right, so hey, thanks. Megan says everything's working great. Thank you. Hey, Hillary. Londi said acupuncture never made any sense anyway to her. Well, you know, I'm not knocking it as an entire thing, but at least in this specific situation, there's just no evidence that it is of any benefit. So I just keep that in mind. All right, Gabby. Let's see. Gabby says, wondering how long it takes for iron supplements to start to work. She's 34 weeks. Had a hemoglobin of 10, been dizzy, exhausted, a lot of muscle spasms. So, you know, I definitely think it's a good idea to be taking an iron supplement with what I would call sort of a mild anemia with a hemoglobin of 10. You know, you may or may not notice much relief in your symptoms if you went from, say, a hemoglobin of 10 to 11, but it may help some, but it probably takes at least a couple of weeks. So I would stick with it and see if it helps, but it may just be more to do with the fact that you're 34 weeks pregnant and maybe getting some sleep disturbances from the ongoing pregnancy. We know that that can be very tiring. So doing your best to sleep and stay hydrated and all those things maybe helps. Keep taking the iron for sure, and hope that it helps. Okay, so let's see. I'm just going to swing up here to YouTube and see if there's any comments that I missed. Let's see. Rachel, stopping the pill next month, is there a peak fertility? That's a good question. So that's been looked at, and I'm going to give you the short answer, and the long answer is check out, there's a YouTube video on my channel that talks about maximizing your natural fertility. And one of the things in there is they looked at fertility outcomes sort of month by month, and in terms of month by month from when you started trying. And most of the people, or not most, but the highest rates of fertility did occur in the first few months. Now it was like 2, 3, 4 cycles, something like that. So there is something to that basically you want to get going right away when you start trying. It's not clear why. That really wasn't addressed in the study that I'm referencing. It was just an observation. So max fertility is probably in the first few cycles when you start trying. Doesn't mean you can't get pregnant after that, obviously. So it's a good question. Let's see, I think I saw another question up here on Facebook, or sorry, on YouTube. I'm doing both at the same time. All right, Zara says, 27 years old, taking an SSRI, wants to conceive, and worried about heavy periods and maybe some anemia. So, you know, there's no evidence that SSRIs are in any way dangerous in terms of reducing fertility or causing problems with infertility. So don't worry about that. You know, there are still just kind of in general some occasional lingering concerns. I'm just going to adjust this here. Some lingering concerns about SSRIs with certain types of birth defects, but the evidence is really not strong. So, you know, I recommend that, you know, if you're someone who's depressed and you need to take an antidepressant or severe anxiety, keep taking it. You know, don't stop. The risk to a mom and obviously to her baby if there's severe depression is much higher than whatever small possible theoretical risks there might be from taking the SSRI in the first place. So, you know, I encourage you to keep taking it. And then as far as iron supplements, I would definitely take one every day if you're having heavy periods. You know, the only question there is if you have a history of heavy periods that hasn't been evaluated, then, you know, then maybe thinking about getting an ultrasound just to make sure there's no uterine fibroids or anything with the uterus that's causing those heavy periods, and assuming there's not, then just take your iron if you're a little bit anemic and you should be fine. Okay, so let's see. Marion says, what's a natural way of inducing labor that's known to help? There are none. Actually there's a video on my YouTube channel that's called something like how to induce labor naturally at home, and I basically took one of these kind of generic robot videos from YouTube and just kind of commented over top of it. But the gist of it is there's really nothing out there that we know of that will naturally induce labor. There's lots of kind of home remedies and wives' tales and whatnot, but there's nothing out there that's been proven with any evidence. So basically it's, you know, wait for a baby when baby decides. Now I do agree that 39 to 40 weeks really is the best time to try to conceive, or try to have a baby, just based on the ARRIVE trial. So there's a video on my YouTube channel about that as well. So if you're curious, you can check that out. All right, cool. So let's see, what's a good way to boost fertility after IUD removal? So there's nothing that you need to do necessarily to boost your fertility after your IUD's out. The contraceptive effect of an IUD is immediately resolved. So I've seen people get pregnant, the same month that they took their IUD out. So I don't think you have to do anything special in that regard. Just kind of let it do its thing. And if you're curious about just in general how to maximize your fertility, check out the video on my YouTube channel. It's called something like How to Maximize Your Fertility Naturally. There are some tips, but it's nothing specific to the IUD removal. It has more to do with sort of monitoring for ovulation and has to do with frequency of intercourse. There is evidence that basically more is better when it comes to intercourse. We used to say, don't have sex every day, go every other day or whatever. And actually that actually leads to lower pregnancy rates. So daily intercourse in the several days leading up to ovulation really is your best chance for conception. All right, just gonna jump up here to YouTube for a second and see. Let's see. So Rachel said VBAC calculator gave her a 51% chance. Yeah, I mean, generally speaking, we encourage folks to, I would encourage folks to try if you're hitting, about 60% or so, just because it's basically better than 50-50. That's a somewhat arbitrary number. That's what our college, ACOG, picked out as the cut point to suggest that you should encourage someone to try. I've definitely had people try, with lower numbers than 50. It just unfortunately means you have a higher risk of needing to have another C-section for a failed trial of labor, but it doesn't mean you can't do it. So just kind of food for thought. All right, so let's see. Judy says, how do doctors feel when patients wish to skip cervical checks? Well, I can't speak for all doctors, but I can tell you that to me personally, I don't really care. I don't think it's necessary to check somebody's cervix every time you see them in the last month of their pregnancy. We often do as a matter of routine or because a lot of patients want to know. Some people like to know, am I making some progress? Is my cervix doing anything? And that's totally fine. I think it's useful from a triage of labor perspective. So if I know somebody was 3 when I saw them in the office today and they show up 4 or 5 centimeters that night contracting, then I know that they're in labor. So I think it's useful from that regard, but by no means do I feel like, oh yeah, you gotta do it. I don't know that anybody, feels like really strongly about that. Any particular doctor, I guess anybody's welcome to have their own opinion, but I really don't think it's that big of a deal if you don't want to get checked. I would encourage someone to get checked if they said they're, feeling lots of pressure or having lots of contractions, that kind of thing. All right, cool. So I think I'm pretty much caught up on Facebook. Let's see how YouTube's looking. I think I'm pretty good and caught up here as well. Thanks for the encouragement there, Zara, about doing the lives. I really like doing the lives myself. It's actually the most fun thing I do, just because I can kind of sit back and chat with people and answer your questions directly. So I enjoy it. Thanks for the encouragement. Okay, well, I'm caught up on 2 channels going live at the same time. So if anybody else has a question, let me know because I am all caught up. Yeah, that's it. I'm even. Gonna take a sip of tea here. No kombucha today. Already kombucha today. I did try something new today. I tried it with my wife. We went to this place in town that does cryotherapy. So you get in this giant, looks like half of a spaceship capsule, and it goes down to like, I don't know, 290 something below zero. It is cold. All I know is it was cold. And it's supposed to help with, inflammation and stuff. And at my age, I'm running a half marathon tomorrow. I'll take anything I can get. So we'll see if that helps. And you never know, one of these days we might get one in the office. So stay tuned. Okay, let's see. Do I think that plus size women can have a normal pregnancy as other women? Do you think size makes a difference? So there are some risk factors that are out there, and it doesn't mean that any one individual person is going to have a complication just because of their weight. But if you look at big numbers of women and follow their pregnancies, and you compare outcomes based on body mass index, so how much you weigh for your height, if you look at 2 things, if you're in the overweight or above type categories, or if you gain excessive amounts of weight based on your body mass index, there are studies that would show you have a higher risk of C-section. So I definitely think that regardless of weight, but maybe especially if you're overweight, try not to gain more than what the Institute of Medicine guidelines would state is a way to reduce your C-section risk. And there's some other things you may be at higher risk for, like gestational diabetes, preeclampsia, and maybe some other things too. But those are the big ones. But certainly plenty of women who are overweight or beyond have had successful pregnancies and done fine. But I do think that the risk is a little higher, and that's just based on the available evidence that we have. Okay, let's see if there's anything up here on YouTube. Is there any way to increase the risk of having twins? Well, I mean, fertility medications, can do that. I don't encourage anyone to try to have twins or more than twins, just because the risks are higher. Higher risk of preterm birth, higher risk of preeclampsia and diabetes, and all the things I was just kind of talking about that had to do with overweight women actually also pertain to people who have twins. So I don't encourage you to try to have twins on purpose. Not that we control that completely anyway. But it's one of those things I wouldn't say, oh yeah, let's try to get some twins. So just keep that in mind. Let's see what else we got. Rachel said, she told she had 20% risk of miscarriage. There's really not a whole lot you can do from a prevention standpoint for miscarriage. There have been lots of studies trying to look at different things. There are certain scenarios where there are treatments available. So for example, if you have antiphospholipid antibody syndrome, that is a thing that, I'm gonna pull this down here. I think this looks weird. Let me know if this is better. If you see me on YouTube, let me know is this better or worse. I think I like this angle better. There we go. So antiphospholipid antibody syndrome is a condition that is basically like an autoimmune disorder that leads to blood clots and strokes and other conditions, but in pregnancy it may lead to pregnancy loss, either early like miscarriage or even later in pregnancy. So if you have what is known, if you have that diagnosis, which is made by blood work, then there is treatment available, because we put those folks on a blood thinner like heparin and also a low dose aspirin. So that's a specific situation, but you have to test. Thanks for the better. You have to test for that one. And then there's not a whole lot else. I mean, people have looked at progesterone supplementation, really not great evidence that that is helpful. We've looked at using aspirin, just like when you get pregnant, low dose aspirin, pretty mixed results there too. Nothing really overwhelmingly convincing that it helps. So yeah, it's one of those deals, like, antiphospholipid antibody syndrome, and then lesions within the uterus. So whether that means like a fibroid, yeah, aspirin and progesterone, we talk about it, but like I was saying, the evidence is just not super strong that it makes a big difference. I do it as well, and I just kind of, cross your fingers and hope that it helps. And the other thing is that, most of these studies are just sort of generic. They've had recurrent miscarriage, and there's not a whole lot of other delineation of any other risk factors. So there might be people where progesterone helps. There might be people where aspirin helps, and we just haven't done the right study to figure out, who are those people, what is that situation. So I still think it's fine. I just know from a review of the evidence that it's not super helpful, at least within studies that have been done so far. All right, let's see. Is there any method of contraception other than using condoms and pills? Well, yeah, as a matter of fact, there's a video on this YouTube channel that is called something like "What Can I Do for Birth Control?" And it kind of runs through all the options in some detail and talks about risks and benefits and side effects and stuff like that. So you might check that out if you're curious. But I mean, there's IUDs, there's various types of IUDs, hormonal, non-hormonal. There's the NuvaRing, which is a vaginal ring. There's the Nexplanon, which is a little insert that goes in your arm. So, any of those are good options, and any one of those is perfectly fine to use. But check out, ablation is not really birth control though, dude. People can get pregnant after an ablation. I have seen it, and it actually, it can be pretty risky. So I encourage anybody who's having an ablation to either have their tubes tied or have their partner have their tubes tied. Okay, so let's see. Lori says 28 weeks with the first baby. She's O negative. Husband's A negative. Never said anything about needing to do anything because of it. Yeah, and you're asking about rhogam and do you have to do it or not? So yeah, so the question you're asking is rhogam, when do you give it? So we give it routinely to all moms who are Rh negative. So if you're O negative, that would be you. And the reason that we routinely give it to everybody is that most dads don't necessarily know their blood type. So, just right off the bat, about 85% of folks are Rh negative. So if you have no idea what your blood type is, then the odds are you're positive. And so we treat with rhogam to prevent what's called Rh sensitization. Now, the trick is if two things. If you know for a fact that your husband is A negative, anything negative for that matter, and then if you know for a fact what they say, paternity is certain, and there's no judgment there, but that's not always a certainty, then it's fine to skip the rhogam and just play the science of the matter, which is if we're both Rh negative, our child will have to be Rh negative, and therefore the rhogam's not necessary. But if you read the textbook, it says what I said, which is, well, not everybody knows their blood type. Not everybody who thinks they're Rh negative actually is Rh negative. There could be a lab error, for example, with prior blood typing. So putting it in the category of playing it safe is why most people would recommend get the rhogam. But I just explain that to my patients, and if the dad like whips out his Red Cross donor card and says, "See right here, I'm A negative," then like I said, as long as paternity is certain, then there's really no way the baby could be positive other than a lab error. So you take that slight theoretical risk, but probably not that big of a deal. So that's what that's about. Hopefully that answers your question. Let me know if it didn't or if you have a follow-up to that. Okay, so let's see. Heather, is it a bad idea to get pregnant at a heavier weight, or does it matter? 230 and have a lot of muscle. I kind of was talking about this a minute ago, and you may have jumped home after that, but there are studies that show higher risk of C-section, diabetes, preeclampsia, stuff like that in women who are overweight. So, it's always best to be at the best weight you can for your height. But I tell everybody the same thing. I mean, it's not like it's a deal breaker. I mean, these are just risk factors. And this is your life, this is your future, and far be it for me to tell anybody don't do it, go lose whatever, how many pounds first. But I just let people know, just so you know, there's a higher chance of some of these things. So it sort of depends on where you are in life in terms of how much time you have and how much time you want to spend kind of on some of those lifestyle modification type things before you get pregnant. But it's definitely not a deal breaker, but it's just one of those things that we would, watch more closely for. So yeah, good question. Okay, let's see. Hey, somebody jumped on YouTube. Awesome. So I'm just going to see if there's any questions popping up on YouTube. I think I'm caught up over on that one. All right, cool. So we'll see if anything pops up over here on Facebook. All right, so Jenny, 33 weeks, and Dr. mentioned giving her steroids to get the babies. Now, I don't know if that means 2 babies or more, or if you meant like a baby with a plural. But anyway, to get the lungs to develop, higher blood pressure, not extremely high. Then you said considering taking the baby early. So I think we're talking about 1 baby. So not being a mind reader, I can't anticipate exactly what your doctor was thinking, but it certainly is a possibility that if you're having higher blood pressures, that 2 things. Number 1, they might get worse. So your blood pressure could get higher. And if it was to get higher, then delivery, might be necessary. And if that needed to occur prior to 37 weeks, then it would be nice that you got steroids, because that's going to help the lungs to mature and reduce the risk of respiratory complications for the baby. So there's really no downside to giving a course of steroids at this gestational age. So probably just your doctor's playing it safe and realizes maybe there's a chance that you're going to need to be delivered early. And that probably is why they're recommending steroids, which seems perfectly reasonable and in of itself to me. Don't see any issue with that whatsoever. Sounds like somebody's just trying to think ahead and thinking a couple steps ahead and getting ready maybe. Okay. All right, so I'm all caught up on Facebook. Let's see, YouTube, anything? Let's see. Rachel, what's good for severe morning sickness? Had it last pregnancy. So, I always recommend the same sort of sequence of medications, and it's based on safety and cost. So, it's recommended that you start with the vitamin B6 Unisom combos. So, whether that's the diclegus, which you can get by prescription, which is pretty expensive, or do your own vitamin B6 Unisom combo as over the counter. That one's the safest. There's no prescription necessary, and is dirt cheap. The prescription version is a lot more expensive, but probably equally safe. And if you're having problems with excessive sleepiness from the Unisom at night, then sometimes the diclegus is a little better because it's time released, so it doesn't hit you all at once. Typically, that's where I'm going to start B6 Unisom. Promethazine or Phenergan is the typical next step. And that one definitely makes you sleepy, so just keep that in mind. And then lastly, if all else is failing, if you're losing weight, you're getting dehydrated, nothing else is working, then yeah, Zofran's next. And in general, I don't think Zofran use in pregnancy is a big deal. There are a couple studies that show, maybe slight increased risk of certain cardiac defects, certain facial defects. So it's not like it's not the first thing I'm going to recommend to somebody. I'm going to recommend go through these other steps first if you're in the first trimester, just because, well, the Zofran may have a slight risk. So just trying to play it safe and use other medicines that we know maybe have a little better safety profile, but it's not anything that I worry about. For the record, my wife was on Zofran for like 15 weeks. She actually had a pump that was like continuously pumping her because she kept having to go to the hospital and getting IVs and being dehydrated and nothing else worked. So we had to do it to keep her alive. And our kid seems to be pretty okay so far. He's like 15. And, we'll see how he does on the SAT. But so far, so good. So it's just not the first thing that I would recommend to somebody. Okay, so we'll see if there's any other questions popping up over here on the Facebook side. Doesn't look like it. All right, you guys, if you're watching me on Facebook, ask me some questions. There's way more of you watching me over here. So, hey, Ashley, and by the way, hey, Bethany, just saw you jumped on too. It's good to see you guys. Just doing the usual Ask Me Anything Friday afternoon here. Let's see. I don't see anybody else. Didi mentioned that the promethazine made her depressed. That's always a possibility. These are centrally acting anti-nausea meds. So they can have other side effects. And I would, say that's definitely within the range of possibilities. It definitely can make you sleepy, that's for sure. Okay, so let's see, Bethany. Baby will be a year in October. Is it too soon to start trying? No, it's, so you figure most people, of course, don't get pregnant right away, first try. It can happen. But you figure October, so you're about, 3-4 months away from that right now. 4 or 5, I guess. In an ideal world, you put about 2 years between deliveries. It's not the end of the world if you get pregnant sooner. So I don't think it's like, no, you can't do it. There, may be a little higher risk of some problems, but nothing that's overwhelming, nothing that I would say is a deal breaker. The official answer is you're supposed to, if you choose to, is to put 2 years between deliveries, but I don't think it's a deal breaker. You're getting pretty close. So if you got pregnant, I'd be thrilled to see you, and I think you'd probably be fine. Okay, let's see. Shaylee has a cerclage and have a lot of contractions, but now 37 weeks, they've disappeared. Is that normal? Yeah, so I pause there for a minute. So I'm like, you still have a cerclage at 37 weeks. It's fine if you do. Some people take them out, when somebody shows up and they think they're in labor. I usually take them out around 37 weeks just because that way, if you do have a lot of contractions, then we're not worried about the cerclage, causing any tearing of the cervix or any problems trying to figure out if you're really in labor or not. But anyway, that's not what you asked me. It just caught my attention. So anyway, the contractions have gone away for now. They've gone away for now. They'll be back. So yeah, I think it's normal. I don't think they'll go away forever. So hang in there. I'm sure labor will start sometime soon. All right, let's see. Jump over here to YouTube for a sec. What to take for irregular period. So when I answer this question about irregular periods, one of the things that I talk to people about is, are you trying to get pregnant or are you trying to not get pregnant? Because to me, the answer depends on that answer. If you're trying to get pregnant and you're not having regular periods, then that may indicate you're not ovulating regularly, and so usually we're going to do things to try to correct that situation. If there are medical problems leading to that, like thyroid, stuff like that, then we're going to treat that. And if everything checks out normal, then you may think about ovulation induction with something like Clomid, for example. But if you're, and that'll regulate your periods and it will help you get pregnant. So, but if you're not trying to get pregnant, then you think of, most of these are hormonal, so treating them hormonally. So, for example, either something like a birth control pill or a NuvaRing, or even an IUD, like a Mirena, for example. Any of those things will either help regulate or suppress your period and get rid of the irregular nature of that. So, yeah, good question. All right. So let's see if anything else is popping up over here. I think I got everything covered over here. All right, so you guys are watching on Facebook, welcome, and welcome on YouTube. The questions so far have all been answered. So if you're just jumping on and you got a question, now is the time to type it in the comments. While I'm waiting for somebody to give me a question that I can answer, and thanks to everybody who has given me questions, because without the questions, I got nothing to say. I'm just going to plug the YouTube channel, my daily YouTube plug. Wes D Ski is the channel name. I just typed it in the comments there. So if you just copy and paste that into YouTube, you'll find my channel. And there's a ton of videos on there. I think I'm up over 100 and some videos now. And a lot of the questions that we talk about on the live broadcast are covered in a lot more detail on the YouTube videos. So I mentioned that as a friendly reminder, hey, a lot of this stuff is fleshed out in a lot more detail over there. So check it out. I'm glad we're here on the live because I think it's super fun and I'm happy to do it. So let's see. I think I saw something pop up over here on YouTube. What do I think about pregnancy at 39? So yeah, and like I was saying just a second ago, plug the YouTube channel. There's a video on my channel called "Is 35 Too Old to Get Pregnant?" And the answer is no. It's so funny. I've gotten so many comments like, well, my mom got pregnant when she was 38. And I was like, I'm not saying you're too old. It's called a title. It might be slightly clickbait to get somebody to click the link. But anyway, pregnancy at 39 is better than pregnancy at 40, is better than pregnancy at 41, etc. So no time like the present as far as that goes. And if you're thinking about getting pregnant, my advice is be aggressive, start now, don't wait, just because fertility does decline year over year. There are a little bit higher risks for chromosomal abnormalities. Down syndrome is the one everybody knows about. There are many others that fall in that same pattern called trisomies. So those are definitely higher risk in folks over 35 and definitely at 39. But it's by no means a deal breaker. It's not like I'm saying don't do it. You just have to know going into it, it's a little higher risk. Now the good news is there's testing available nowadays that we can do as early as 10 weeks with a blood test. So we can test basically the baby's DNA from the maternal circulation. So we can draw your blood and then we can test that blood for baby's DNA and know at pretty high levels of certainty, whether or not we have any concerns about the major chromosomal abnormalities. So Down syndrome, trisomy 21, trisomy 13 and 18 that don't really have a name that anybody remembers, and the sex chromosome abnormalities. Those are the most common things that, right, and the gender, exactly. So with the sex chromosome testing, you can learn the gender. And that's, become pretty much the standard of care test for folks over 35 who want to have a test because it is non-invasive, it's early. But none of those things are deal breakers. And kind of like I was, it's interesting, a lot of these things, they're recurring themes, so you have a little higher risk of maybe some high blood pressure, diabetes, maybe preterm birth, stuff like that. C-section maybe even as you age, but it doesn't mean everybody who is 39 and has a baby is going to have those problems. It just, if you compared it to somebody who's 21, there's just a difference you can see. So definitely encourage you to go to the YouTube. My playlist is probably under the preconception, trying to conceive, infertility, something like that, and it's called as 35 too old to get pregnant, which of course it's not. Okay, so let's see. Amber, how many people are allowed in the room for delivery? Honest answer, I don't know the number. It's a lot, and it varies by hospital. So, you know, for us, we work at Ogden Regional and McKay, and they both have slightly different policies on that, and they are sort of, what's the right word, intermittently enforced. So if let's just say the number's 5, I'm making that up, but I think it's not too far off, and suddenly there's 6 people, but it's chill and, you know, no one's being disruptive and there's room and everything's going okay. You know, me personally, I don't care if it's 6 or it's 5 or it's 12. As long as there's room and we're able to take care of mom and baby. Sometimes when you get higher numbers of people in the room, you know, it can be a little disruptive just because there's lots of side conversations going on. People are talking on their phone and, you know, I'm just trying to take care of the mom and the baby. But within reason, I think it's fine. And maybe it's 5, maybe it's not. But whichever hospital you're delivering at, you can call labor and delivery and ask them if they have a policy. I'm pretty sure they do. And they can tell you what the official answer is. Okay, let's see. And let's see, Bree was saying, wondered about diet and exercise, and that was to do with age. Well, you know, being physically active, weighing an appropriate amount for your height, eating a healthy diet, all definitely have all kinds of benefits. There's no question, and that's really regardless of age. So those are all important factors, and I would encourage anyone trying to get pregnant to be mindful of all those things, and they definitely help. The one thing they don't change is your birth certificate. Father time is undefeated, so you know, that age thing's still there, but you know, to the extent you can make things better, those things help. So definitely encourage that. All right. Let's see. So Rachel started the acid diet to conceive a girl. Well, Rachel, jump on this video. It's called How to Conceive a Girl Naturally or something like that. It's on my channel. Basically, there's no evidence that any of these diets, the acid diet, none of the methods like the Shettles method, the Chinese lunar calendar, how you have sex, when you have sex, none of it's ever been proven to cause you to have a girl or a boy. So, you know, I don't even know what the acid diet is, but I know the idea is you're trying to make the environment more acidic, and that's to somehow favor, you know, chromosomes that bear the sperm that bear the X chromosome. But there's just no proof whatsoever. So I don't necessarily think that it's harmful, but I also know that there's no proof of it working. It doesn't mean you can't do it, and I wish you the best of luck, but it's pretty much 50-50 on that one. Let's see. Yeah, there's just no evidence for the acid thing on the girl sperm, but I don't think it's harmful, so, you know, good luck. Okay, so let's see. Jump back over here to Facebook. Alyssa, if I really want to get pregnant with twins but don't have to, yeah, I wouldn't recommend it. I was talking about that a few minutes ago. Someone asked a similar question. I really don't recommend that anyone try to have more than one baby at a time, only because the risks are higher, the complications are higher, especially for preterm birth. And that's a real problem. You know, you definitely see plenty of people carry twins to term, and don't get me wrong, it happens all the time, but we just know the risks are higher. And the risk is actually higher that you lose the entire pregnancy and don't take home a baby when you have more than one baby in the uterus. So, you know, for all those reasons, I would never encourage anyone to intentionally do something to try to have more than one baby. We look at twins as an unfortunate side effect of something like Clomid, and we take it. It's a risk. We know it, and if it happens, we're happy for the patient, but we'd always rather see one baby in there than 2, just because it's safer for mom and baby. So I personally wouldn't recommend you use Clomid to intentionally get pregnant with more than one baby. All right, Megan, if you're having normal monthly periods, are you ovulating? Pretty good chance. Now, what I tell people is, if your periods are regular, if you have some sort of premenstrual symptoms before your period starts, whether that's bloating or moodiness or breast tenderness or whatever, and those symptoms get better when your period starts or as your period's ending, then it's very likely you're ovulating. You can do blood testing around day 21 of a cycle for progesterone, excuse me. And if your progesterone's over about 10, then that's confirmation of ovulation. But I don't generally tell people they need to do that. I think if you're having regular periods, if you're having premenstrual symptoms, and other things you can do like the cervical mucus changes, you can look at ovulation predictor tests. All those things lend evidence to whether or not you're ovulating. And if all those things are saying you're ovulating, then I'd feel confident that you're ovulating and really don't need any special testing. I think that if those things are not the case, or we're still not sure, then I would recommend maybe doing some follow-up in the office. Okay, so, Amber, is the keto diet okay? I'm gonna take a little drink break and then I'm gonna answer that question. I mentioned before that a lot of these questions are answered in more detail on the YouTube channel, and this is one of those questions. So I don't recommend anyone to be on the keto diet if you're trying to get pregnant. Now, you didn't say that specifically, but or if you are pregnant even. But if you're trying to get pregnant, there's actually evidence that the keto diet increases the risk of spina bifida. And it makes sense when you think about it, because you're avoiding basically all grains, and all the grains in the US are fortified with folate. So a lot of our folate intake comes from our diet, and we don't really know, like say you're on keto and you're completely avoiding those food groups, how much additional folate do you really need to take to combat that, number one, and then number two, is there anything else to the keto diet, like, for example, the ketones themselves, that is somehow harmful for either brain or spinal cord development? And so I don't recommend anybody who's pregnant or trying to get pregnant be running around ketotic, because there are some potential risks. And a recent study that was the basis for the video I made demonstrated there was a quantifiable increased risk of spina bifida. So that's why I don't recommend the keto. Now, if you're not trying to get pregnant and like say you're on birth control and it's not really an issue, then I think, hey, if it works, great. I don't have much insight on the non-pregnant situation as far as that goes. But I do feel strongly you shouldn't be on keto if you're trying to get pregnant. Okay, Courtney, is it normal for your period to become light after having kids? Actually, interestingly, most of the time it seems like it gets heavier, at least the people who talk to me. Very few people ever come in and say, I'm here because I wanted to tell you how great my period was. So I definitely have a bias towards seeing people who are having problems. Either having problems getting pregnant, or they're having a baby, that's not a problem, or they're having a bad period, or they're having heavy periods or whatever. And so what I have observed over the years is it seems like the more kids you have, the tendency is the periods get heavier, not lighter. And I've always kind of thought of that like, well, the uterus definitely gets bigger every pregnancy. You can see that just through observation, ultrasounds, taking out uteruses with hysterectomies. In people who've had no kids, one kid, or a bunch of kids, there's definitely a difference. So I think the uterus gets bigger every time, and so there's more uterine surface area, and that's why I think the periods tend to get lighter. So I'm glad if your periods got lighter, as long as that's, they're not stopping and you're trying to get pregnant. So I can't really say it's normal or not normal. It's different from what I've observed over the years, but it doesn't mean it's not normal. Okay, let's see what's going on over here on Facebook. I mean YouTube, where am I? Let's see. Let's see, asking a question here, Rachel, about finishing the pill, having some hormonal imbalance, heavy periods, needed DNCs or anything vitamin-wise. Yeah, there's no evidence of any particular vitamin supplementation to help with heavy periods. Typically the answer is it's usually hormonal. So hormonally induced problems are often addressed with hormones. So like we're talking about birth control pills, for example. But there's nothing I'm aware of that you can take as a supplement that's going to make your periods better or prevent your periods from getting worse. Let's see. LaShonda, any natural remedies safe to take when you're trying to get pregnant to regulate cycle if you have PCOS? Yeah, there's really nothing. Diet, exercise, weight loss, those kind of things are the most important aspects of just having a healthy weight for your height. That's one of the things that has been shown in PCOS to help improve the regularity of your periods. and basically increase chances for ovulation. But again, no supplements that I'm aware of that would help you on that. I think I may have missed one back here. I'm going to roll back for a minute. No, maybe not. I think I got everything. All right, cool. Looks like I'm all caught up on YouTube. I'm gonna swing back through the Facebook questions here and see if anybody got left out. If you haven't had your question answered, put it back in the comments. Sometimes it just doesn't come to me on the feed, and I don't know that I missed you. So I'm just looking back through. It's looking like I'm caught up. Okay. Swing back over here on YouTube and see. I think I'm good here too. All right, cool. Well, let's see. Just gonna check on the stream. B6, good for heavy cycles, or ibuprofen. Yeah, ibuprofen may help some people with heavy periods. There is evidence that, and rather than bore you with the whole physiology of it, but basically arachidonic acid metabolism is affected by non-steroidals like ibuprofen. And some people are more prone towards metabolism that leads them towards heavier periods or crampier periods, and ibuprofen can shift the balance away from those and make you have either lighter periods or less crampy periods. So ibuprofen is actually a therapeutic option for somebody with heavy periods. It's one we kind of overlook sometimes, but there is evidence that it helps. So yeah, that's a good one. Okay, just gonna check over here on the stream, make sure everything's still streaming good. And if you guys have other questions, I'll answer them. We'll probably go about another 10 minutes or so and then wrap it up. But this has been great. Okay. Looks like everything's still working. So if you are jumping on and have a question, feel free to throw it in the comments. Completely caught up. I've answered everybody's question, I think. So, oh, here comes one. Thank you. From B and Sam. Great channel name. How often do you have, these, I was like, Tegees. What's Tegees? These live chats. So I do a live stream about once a week, usually Friday afternoons around this time, usually about 3 o'clock Mountain Standard Time. By the way, I'm curious, anybody who's watching, where are you watching from? I know a lot of Facebook's coming from Utah, but there may be some, I saw somebody on Facebook one time from Germany. So if you don't mind, you're still watching, let me know where you're watching from. I'm always curious. But yeah, 3 o'clock, usually on Friday afternoons, Mountain Standard Time here in the U.S. And then that's what, 1 hour early from Pacific if you're coming from West Coast, California. There you go. So about 2 o'clock your time. I do them some Tuesday afternoons. That's my surgery day. Some Tuesdays I'm done with surgery early and I'll do them then instead. But so Tuesdays and Friday in the afternoons, I haven't established like a definitive schedule, but that's kind of how it tends to work out. Syracuse, Utah. Hey, Megan. All right, that's good. See anybody else out there that wants to tell me where they're watching from. We got some Roy. All right, cool. We'll see if any other questions pop up. Let me know where you're watching from if you're still watching. Oh, here's one. And the UK. Wow, Rachel, I didn't realize that's where you were watching from. That's amazing. Thanks. It's 11 o'clock at night there. That's awesome. Let's see. Nicole, how can you get swelling in one foot to go down? The royal wedding is tomorrow. Yeah, I don't know anything about that, but I know that it's a big deal. Swelling, you know, the main thing you talk about, if you talk about swell in Guam, holy cow, someone's watching in PA. Alyssa's watching from work. Oh man. Swelling in your extremity, the main thing I say, if you have unilateral swelling, so one leg, 1 foot, is it smart to make sure that you don't have a blood clot in that extremity, you know, typically a venous thrombosis in the leg is where that would come from. Assuming it's not super swollen, it's not painful, it's probably not that, but not wrong to at least think about that. But assuming that you don't have that, then something as simple as just like support socks, for example, can help get some of the swelling down. So maybe think about that. What do I think about black seed oil? Honest answer, I don't know the first thing about it. There's not, the problem, at least in the U.S., is that the supplements are not really studied, not regulated. And so with rare exceptions where someone, in an academic setting has tried to do a study with a particular supplement, in general, there's just not good evidence out there that tells us what, a particular oil or supplement is good or bad. So the honest answer, we really don't know. Let's see, Vitex. Yeah, kind of same thing. It's another one of these supplements. They do make some claims that it's supposedly better, but I've never seen a study that like a randomized control trial where they gave half the people Vitex and half the people a placebo or a regular vitamin or whatever. There's just no evidence I'm aware of in any peer-reviewed published journals that says it's better or worse. I know some people recommend it, but I've not personally seen any studies that tell us. Oh, we got a couple people at work watching this. That's hilarious. Okay. Chris and Alyssa, well, it is Friday, so it's not as busy on Fridays at the office, so that's pretty cool. Let's see if there are any other questions that popped up that I overlooked. The UK, Rachel, I think you get the award. Well, Guam. Okay, which is further away, Guam or the UK? That's probably demonstrating my lack of geographic knowledge. Guam's in the Pacific, right? So it's probably closer to me than the UK. But still, that's way the heck out there. What time is it in Guam right now? It must be, what about 4 hours ahead? Maybe it's noon there, something like that. What do you say, Lori? What time is it in Guam? Okay, so it looks like I'm caught back up on questions. If you guys have any questions, we'll probably go another 5 or so minutes, maybe 10 minutes. The questions are kind of dying down, which is fine. Just means I've answered everybody's questions, which is great. So the key question is, what time is it in Guam? All my computers are doing computer stuff right now, so I can't pull up another window. Let me see. Guam. What time is it in Guam? 12 minutes, maybe 10 minutes. Whoops. What time is it? Guam. It's Saturday, 8:13 in the morning. That's crazy. 8 a.m. Saturday. That's nuts. So you're in tomorrow. We're still here today. That just blows my mind every time. Yeah, so when we went to New Zealand, you almost, when you come home, I think you like almost land before you left. It's bizarre. So 8 in the morning on a Saturday. Wow, that's awesome. So are you over there, Lori, with the military, I'm guessing, maybe? If you used to be here in Utah? Let's see. Here's some actual other questions. Let's see. LaShawna said, what's a good eating schedule to eat if you work the night shift? That's a great question. I don't know of any studies that have looked at that there may be out there, but they're just not something that I've seen in the OBGYN literature. I know that there's all kinds of evidence that sort of off-schedule working like that, it does mess with your circadian rhythms and stuff like that. I think a lot of people sort of just adopt that as their day and eat like that's the day, and then they sleep in the night like but that would be the daytime. But I'm not aware of any evidence that really answers the question specifically. Let's see, can you take prenatal vitamins while still on the pill? Absolutely, yeah. I mean, prenatal vitamins just basically a good multivitamin, and in of itself is not something that you have to be pregnant or not. I've actually taken them just for the heck of it to see, and I will say some of them taste awful. They're just terrible, and I understand why if you're pregnant and you feel crummy, you don't want to take your vitamin, it makes you feel worse. So they do, some of the more expensive prescription ones are enteric coated, so they don't dissolve in your stomach, they dissolve a little further down your digestive tract, and you don't get all that nasty fish burp and that terrible iron taste. But they're fine to take, so if you can stomach them, it's just like taking a really good multivitamin, so no harm in that at all. Let's see. Garden of the Raw, Amazon Organic. Cool. Yeah, okay. Rachel endorses Garden of Life Raw. Check it out if you want to on Amazon. Okay, let's see. Kaylee, if you want to conceive and have Mirena, how easy is removal? Usually pretty easy, not always. And rates of pregnancy following um, are really no different than rates of pregnancy before the IUD. So it's immediately reversed. That's one of the nice things about most modern contraceptives. There's really no lingering effect of just about anything, with the exception of Depo-Provera. The shot takes forever to get out of your system. I've seen folks not ovulate for a year after one shot of Depo-Provera. So that one I don't recommend if you're thinking about kids anytime soon. But the nice thing about Mirena, nice thing about birth control pills, when you stop taking them, there's no delayed return to fertility. So it took you 8 months after birth control pill, but it wasn't because of the birth control pill. That's just how long it took. So, you know, I don't expect you to have any delayed return to fertility with that Mirena. I hope you get pregnant really quick, if that's what you want. There's a funny commercial, a few years back here in the U.S. about the stork. I don't know, does the stork deliver babies in the U.K.? That's a question. If the stork delivers babies in the UK, Rachel, let me know. But in the US, that's like the thing some people tell kids, you know, the stork's gonna deliver the baby. And there was this commercial that basically the idea was you could get pregnant anytime. So the stork might find you, you might find the stork. So anyway, that's what that was. It was kind of dumb. Kaylee, horror stories about implanting. It's actually fairly uncommon to have an IUD embed in the uterus. It does happen from occasions. But in of itself does not put you at any higher risk. It does, yeah, the stork's there too, huh? Cool. But there's no evidence that an embedded IUD that has to be removed reduces your chances of pregnancy occurring. So I don't worry about that. And the duration of use does not increase or decrease the risk of that. It's more about just if it's positioned correctly or not. So I wouldn't worry. You know, the thing that you said, you know, talk about hearing horror stories, that's typical. You know, very few people who are like, waiting for the story. Very few people who everything went fine and they had no problems. They generally don't go around telling awesome stories. Like there's no drama in that. Like, yeah, I had an IUD, I took it out, I got pregnant. That's just not as exciting, you know, as I had this horrible thing and it was awful and blah, blah. So I don't know, it's something to do with human nature. And you hear this all the time too from pregnant people, like, you know, I'm really worried now because everyone says, you know, I'm too big or I'm too small or do I have twins or, you know, whatever. It's just human nature for some reason to try to share bad vibes, bad news. So don't worry about the IUD. Most people take it out, get pregnant, and do just fine. So yeah, I spend a lot of my day sort of trying to calm concerns from other people's horror stories. So yeah. All right, let's see. I think I'm all caught up again. Okay, so we'll go about 5 more minutes, maybe something like that. If anybody else has a question, throw it on the comments. We'll wrap it up after that. It's been a good Friday. Here's one. All right, Elizabeth. Tons of acne since your second Mirena. Are there other IUDs? Yeah, and this may be a thing. And so progesterone is a testosterone derivative. So progesterone IUDs, like Mirenas, for example, do have this progestin activity. That's why they make your periods lighter. That's one of the reasons they're so effective for birth control. But a potential side effect is acne. It's the same reason some people get more acne when they're pregnant, is you make up more progesterone when you're pregnant. Excuse me. So either going to a lower dose, if you like the idea of the hormonal IUD, then, you know, like for example, Kyleena is less than half the dose. It's probably almost a third the dose of Mirena. So if you're having progesterone side effects, then maybe switch into a Kyleena, or just going hormone free, so like a Paragard. The thing about the Paragard, still good birth control, but heavier periods is the #1 thing people complain about, and it's fairly common. So you might just think about switching to a Kyleena, or just you know, doing something different for the acne. See a dermatologist maybe. But if you feel like it's related to the Mirena, maybe switching it up for a Kyleena or going to a Paragard. Birth control pills we think do better in this regard because they have estrogen and progesterone. So the estrogen is generally thought to help with acne. So like, for example, that pill, orthotricycline, it was marketed for acne, and that's because they did studies and submitted them to the FDA that showed that there was improvement in acne. We think in general for birth control pills, most of them help in that regard. So I don't think that it has to be tricycline, but it just proves my point that the estrogen component probably is helpful. So long-winded way of saying, yeah, it could be the Mirena. I do think that's a thing. Okay, so let's see. We have now been streaming for an hour. That's crazy. Okay, so if anybody else has a question, I will be happy to answer here the next couple minutes. If I don't get to your question because you missed it, you can put it in the comments. I usually check back on these and answer them later if something else pops up. Okay, here we go. Krissa, CBD oil for headaches and migraines. Do you recommend stop using it when pregnant? Probably, playing it safe, I'd say yes. The problem is, like a lot of things, there's just no data. There is data that's concerning for marijuana use in pregnancy, and there's actually a video about that on my YouTube channel. Now that's different, of course, from CBD oil, which is hemp oil, and it's a derivative from the hemp. But it is part of what you get exposed to in marijuana. So it's really hard to know, which component is the part that might be a problem during pregnancy. But there are studies that show that marijuana use in pregnancy, there's some concern about brain development. There's some evidence for interfering with neuronal migration when the baby's forming their brain cells. So if it was me, I'd play it safe and not take it. But I will honestly say I don't know of any study that looks specifically at CBD oil. I don't know of any study that says that it's bad. I'm more just speaking in general with regard to all the components that are in marijuana, of which CBD is one. So I wouldn't lose a lot of sleep if somebody came in pregnant and had been taking it and then just figured it out. Oh my gosh, I didn't realize I was 12 weeks pregnant. I've been taking this. I'd say it's probably not that big of a deal, but I wouldn't do it on purpose just to play it safe. Okay, Ashley, gonna start taking Clomid soon, and there's a higher chance of twins. It's true. So I tell people that the risk of twins from Clomid is about 5%, and that's about double the risk in the population at large. So there is a slight increased risk, but it's not a huge risk. So I do counsel patients that that's a thing, but it's not something that I worry about as long as you've been counseled and then you recognize there's a slight increased risk. Okay, Melissa, how many rounds of Clomid would you allow to someone to take before recommending something else? Okay, so this is just what is known as just my personal philosophy. There's no right answer on this, but this is just what I do. So in general, I recommend to people that you do 2, 3, 4 cycles of whatever it is you're doing before you move on to the next thing. So, Clomid, for example, once we get you ovulating, 2, 3 rounds of ovulating on Clomid. If you're not pregnant, I'd move on to Femara. And then same answer, 2, 3 rounds of Femara. If you're still not getting pregnant, I'd move on to Femara plus follicle stimulating hormone injections. And same thing, 2, 3 rounds of that, you're still not getting anywhere, I'd go full on injectable. And then if you're not getting anywhere with injectables, then it's IVF. But 2 to 3 rounds of just about anything, and then I'm recommending move on to the next thing. It's just my personal philosophy. There is some evidence that prolonged use of Clomid actually does reduce pregnancy rates, and it's thought to be through some anti-estrogen type effects that occur in the endometrium. So it may interfere with endometrial receptivity, things like that. So that's one of the reasons that the 2, 3 cycles is kind of what I've developed over time. But again, that's just my personal take. Everyone who's saying thank you, you're so welcome. Thank you for jumping on. Thank you for asking questions. I'm having fun doing this dueling live stream with YouTube and Facebook at the same time. So this is fun. There are a couple questions over here on YouTube I'm going to answer real quick. And the first one was, is vitamin C good for low progesterone? No evidence I'm aware of. Can you make new eggs if you're older? Unfortunately, no. And Rachel, this is the thing. This is why fertility rates decline with age. So when you're born with about 1 million eggs, I think it is. And then they just kind of slowly die over time. Every month you lose a handful in the process of trying to ovulate. And the quality of those remaining go down as you age. And so basically every month the best one goes, that grows the fastest, makes the most hormones, that gets the most estrogen receptors going, and that whole sort of feedback loop is dependent on this sort of dominant follicle theory, sort of survival of the fittest. So, as you age, you're left with whatever you're left with, and it may still be great, but the point is, they're still the ones that you were born with. You can't make new ones. It's different in guys, and that's why you see differences in fertility rates between men and women with regard to age. So men make new sperm on a regular basis. Now they do still have some risks as you get older, but it takes longer for those things to be noticeable because of the fact that they're constantly making new sperm. But for women, you're born with the eggs that you have, and at every year of your life, you have what you have. That's that ovarian reserve. That's what we call that. So unfortunately, no way to make them better. There is one way to improve fertility if there's an egg quality concern, of course, and that's either through egg donation or using a donor embryo. And the idea there, of course, is, well, we're just going to use a younger donor. So typically, if you're doing donor IVF, for example, they're looking at somebody in their early 20s maybe, because they respond, they make the most eggs, and they're high quality. So hope that answers your question. Okay, I think I got everybody. Oh, I did. Oh, wait a minute, I missed one. What's the oldest patient you've had who's pregnant? 42, 43 is the typical natural age limit that you'll see. Now, again, I'm talking about spontaneous pregnancy, no donor eggs, no IVF, none of that stuff. 42, 43. Beyond that, it's unusual. The miscarriage rate's very high. Once you get above about 44, it still happens. They're definitely reported. But in my personal practice, I don't know that I've seen anybody with a spontaneous pregnancy that was older than 43. Okay. Okay, last question. If anybody's got one, I'll answer it, and then we're going to wrap it up. Thanks again to everybody who has participated in these live streams. I totally enjoy this more than just about anything that I do that is not just delivering babies and taking care of patients one-on-one. This is super fun. I do this just in my free time because I enjoy doing it, and I do get lots of good feedback from everybody out there who's watching. I've actually met people, after the fact that I didn't know before. The other day on rounds, I was rounding on a patient. It was my partner's patient, and I don't think I'd ever met her before. She's like, "Oh yeah, I know you from Facebook." So I just think that's cool. It tells me people are watching, and I really enjoy it. So thanks everybody. Last minute. Oh, here we go, Julia. When does morning sickness typically end? Okay, this is gonna be the last question for this one. If you put a question on here, I will answer it after, just in the text. Go back a little bit and say that some people start feeling nausea in pregnancy as early as 5 weeks. And it's not uncommon to see it developing even up until about 10 weeks. And usually 10 weeks is sort of peak nausea. So most people who are having bad nausea are having the worst of it at about 10 weeks. And usually between 10 and 12 weeks is sort of plateauing. And then usually by about 12 weeks, the average person is starting to see some improvement. There definitely are people who stay nauseous the whole pregnancy, but 12 weeks or so is where things typically start to improve. Most people are pretty good by about 15 weeks. Some people, it just keeps on going. So fingers crossed, if you're getting close to 12 weeks, that things are getting better. All right, so thanks again to everybody who's watching this live stream on both Facebook and YouTube. Thanks for all your comments. Thanks for watching. I really do appreciate it. We'll do it again in probably another week or so on our Friday afternoon, I'd imagine. Actually, no, you know what? Next Friday, I'll be out of town. So probably won't do it next Friday. So maybe I'll catch you on the Tuesday after Memorial Day if check out the wedding. Yeah, who's getting married again? I forget. I know it's Prince somebody and an American person. I know that much. That's all I know. Okay, so thanks everybody who's watching. Have a great Friday. Have a great weekend. Harry and Meghan, best of luck. Congrats. Go get married. All right, see you guys.